Welcome to Face to Face. I am Upendra Mishra, and our guest today is diabetes expert Dr. Om Ganda. He will also be a speaker at upcoming Health Expo on March 10th at Burlington Marriott Hotel. We are going to talk to Dr. Ganda about various myths and the future of diabetes and diabetes cure. Dr. Ganda, welcome to our studio.
Thank you for inviting me.
Sure, and we are looking forward to your talk at the Health Expo. You have been a big supporter of the Health Expo, and you have been a fixture every year, so everybody looks forward to listening to you, and we are glad to have you there this year again.
Good to be here.
Sure. So before we talk about the diabetes and the future cures of diabetes, just have a couple of myths I have heard about it and just wanted to clarify that first. Mm-hmm. So the first myth is that once you are diagnosed with diabetes, and even if it's a type 2 diabetes, then there is no way it can be cured. So what is your response to that?
Right. So first of all, thank you for doing all this good work for the community.
Sure, you're welcome.
It's very, very helpful, and it's a pleasure to do it every year. So to come back to your question, as you know, there are two major types of diabetes.
Sure.
Type 1, also known as juvenile type, but type 1 means that you have it for the rest of your life.
Sure.
Because your pancreas stops making insulin. Type 2 is altogether different. Actually, it's a little more complicated. You are not making enough insulin, and yet whatever you are making is not working very well in the body, something called insulin resistance, a very important concept. So it's all about lifestyle.
Sure, okay.
In type 2, if you watch your diet, eat a healthy combination of meals, watch your weight, and exercise regularly, you can actually put your diabetes into what's called remission. We will never say that you lost your diabetes or you cured it, because it can come back very easily if you fall, in your efforts.
Any one of those factors.
Yeah. So I think basically you can keep it in remission and under very good control. And there are very good studies to show that if you do 4 or 5 of the 7 major lifestyle changes that we all know about, then you can actually have a perfectly normal blood sugar control for a long period of time. But as we all age, your pancreas may start making less and less insulin. So even after your best efforts, you may need some medication or even insulin in many cases. So one should not call it type 1 at that point. It is still type 2, but some people require more medications or insulin depending upon the beta cells in your pancreas.
Okay. So now the next question to you is, the diabetes is especially very common among the Indian and South Asian population. And so why is that?
So it's a very good question. It's actually a very perplexing question. We have known it for a long time. Even among Asian populations, South Asians are particularly at very high risk compared to, say, East Asian, Chinese, Japanese. The other community, for example, is Filipinos. So South Asians, Filipinos basically are part of that, have the highest incidence of diabetes other than Native Americans in the United States. That is one population, again an Indian population. It's been known for a long time that Native Americans above the age of 40, 40% have diabetes. Asian Indians, South Asian Indians that is, particularly are at high risk because their rate is rising. It's about twice as much now as it is in, say, white population.
So what percentage of Indians or South Asians are likely to have any diabetes? Is there any study on that?
I would say if you look at the whole adult population, it's actually not a good way to look at it. Let's say people above the age of 40. As many as 20% have diabetes. But another 20% have what is called pre-diabetes, which should not be ignored because this is the best opportunity at that point to change your lifestyle, cut down your weight if you're overweight. And then you can delay the onset of full-blown type 2 diabetes.
So if you have to recommend 5 things I must do to either take care of diabetes or to postpone the onset of diabetes, what are the 5 things I must do?
The first thing is choose your parents wisely.
Okay, that is not in your control, right?
That is not in our control. So
Sure.
genes are important.
Sure.
Number 2, the diet is important. Number 3, daily exercise, whether it is yoga or whether it is any intensive workout, doesn't have to be very intensive. Brisk walking is a very good exercise. Quit smoking if you smoke, because smoking has not only effects on diabetes, but on heart disease.
Sure.
And there's an intimate connection between diabetes and heart disease.
Sure.
We can touch on that a little bit later. And then finally, I think stress reduction also plays a role. So I think all of these things really affect our expression of the genes, so to speak.
Sure. You mentioned stress. This is, as I interviewing more people, more physicians and experts in this area for this health expo,
Right.
almost everybody is mentioning stress.
Yes. Well, I mean, stress is, of course, something that we can't really do anything about. Some degree of stress everybody has for a variety of reasons. But I mean, again, this is not a very well explored area.
Sure.
For example, there have not been very good studies. For example, stress reduction and onset of diabetes, there is some link between them as
Sure.
the stress affects the whole body,
Sure.
basically. It affects the brain function, it affects the heart function. So stress is an important component of any chronic disease.
Sure.
Yeah.
So now, let's go to the next stage and say I'm able to control the food, the lifestyle, exercise, all stress and everything else. Now, if this has to be complemented by medicine, what are some of the medicines which are commonly recommended for to take care of this? Of course, they are asking our viewers to check their own doctor, but just give us an idea.
Yeah, so we made a lot of progress in the past 20 years. Go back to 1995. We had only 2 medications. One was a pill, which is not used as often as we used to. The other was, if that didn't work, you went to insulin. So since 1995, in the last 24 years now, we made
So
a
I'm
huge
sorry, I'm just curious, what was that medicine was called, the pill was called?
Well, that was a class of drugs called sulfonylureas. Everybody knows these. There were several drugs in that category.
Okay.
Glipizide, glyburide type of things.
Okay.
And so we did not have metformin, which is the most commonly used drug
Today.
until 1995, even though the rest of the world had it.
Okay.
So we made a lot of progress. There are new drugs which are mostly, taken by mouth orally. But there are some injectables besides insulin. So injections which are not insulin, but they help the body in actually promoting the action of insulin or working directly in the gut because they're based on the certain hormones that are made in our own body
Sure.
to prevent diabetes from happening.
Sure.
in the first
Now,
place.
so the technology has really had a big impact on diabetes control. The new inventions and medicines.
Yeah, they have a major impact. I mean, we really have much better tools
Sure.
to control diabetes, and the better we control, the more we delay the long-term complications. After all, it's not the blood sugar. We're thinking about the long-term complications like the eye disease, the
Sure.
kidney disease.
So this was another
the
question I
nerve
wanted to
damage.
ask you that,
Yeah.
so what are some major complications we should pay attention
Right.
to?
So there are 2 types of major complications. One type are that affect the capillaries, these very small blood vessels in the body, not like the arteries in the heart. So these small blood vessels are very important, of course, in the area of eyes and kidneys and even nerves. So this is called microvascular disease. So this is one type of complication that's directly affected by how long you have had diabetes and how well you have had diabetes control.
So how long it generally takes? For example, say how many years it takes to...
It's a long-term phenomenon.
Okay.
So let's say you keep your diabetes in poor control over the last 10 years. You will certainly have some eye damage, and you may have some. All of these complications are also affected by your genetic makeup. The second type of complication is what is called the cardiovascular complications. They affect the major arteries.
Sure.
So these affect the heart, heart attack, angina, things like that. The brain, people have strokes more often with diabetes, and the circulation in the legs, leading to pain in the leg when you walk as the first sign, or a foot ulcer, requiring, again, vascular bypass in the legs. And you might have heard some people need amputation
Sure.
if the circulation becomes very bad.
Yeah.
So we're trying to prevent all of these complications. So the first kind, the eyes, the kidneys, the nerve, are highly dependent upon glucose control. But the heart and stroke and the peripheral circulation in the legs, these are not only affected by blood sugar control, but even more importantly, the cholesterol and the blood pressure. So we always control your ABC.
Sure.
A is for A1C, which is the major measurement of glucose control, and B is for blood pressure, and C is for cholesterol. So that's very important to keep in mind.
Now, let's talk a little bit about the numbers here. So, for example, if somebody, like you do your daily blood test for the glucose.
Right.
So, and let's talk about the early morning test, for example.
Right.
So, for a normal person who has is not predisposed to diabetes and has no diabetes, how much is in the morning sugar level, roughly?
Well, the Mother Nature is amazing.
Okay.
It keeps it in very tight control.
Okay.
So a normal person without, let's say, ever had any history of diabetes before, in normal metabolism,
Sure.
the blood sugar in the morning should be somewhere between 70 and 100.
70 and 100.
Yeah.
Okay. What about somebody who has a pre-diabetes?
Pre-diabetes people, we clearly know now, based on all the work, that number is between 100 and 125. If you're 126, you have diabetes.
Okay.
So another way to diagnose,
Sure.
is actually a new test that has been around now for many years, but it was actually authorized to be the diagnostic test. Is called the hemoglobin A1C. And that one, normal, is less than 5.6. If you're between 5.6 and 6.4, you have pre-diabetes.
Okay.
And if you're 6.5 and higher, you have diabetes.
Okay.
Now, they're not exactly the same thing.
Sure, sure.
In order to really diagnose diabetes well, you need to do both.
Okay, okay. So now I have one more question on these numbers here. So if you have real diabetes and you are trying to control with medicine and everything, what is the flex number? What is how much you can go up to before there is a red warning?
Well, yeah, I mean, so I think ideally, again, it depends. Our thinking has kept evolving as we know more and more. I think the age is an important factor. Presence or absence of cardiovascular disease is an important factor to decide your goals. So, for example, I just told you that the normal hemoglobin A1C goal is close to 6 to 6.5%. But that's very hard to achieve once you have diabetes. It's okay if your A1C is up to 7%. You start worrying about it when it's above 7. And I would not like anybody to have A1C above 7.5, ideally less than 7.
So what happens if you have above 7.5?
Well, then I think you start damaging various cells and structures in the body, cell membranes. They're very sensitive to glucose. So glucose gets attached to the cell membranes. And once the cell membranes get a little bit more sugar-coated, let's say, then their function starts deteriorating. It applies to the retinal cells, it applies to the kidney cells, and it applies to the nerve cells, and all of the rest of the body. So I think it's the chronic phenomena. It is long-term poor control. Short-term poor control, one can treat acutely, but it's the long-term control that determines the complications.
Yeah. Now, how do you look at, I think off the camera you were saying that a few years ago it used to be a death sentence once you got a diabetes. How do you look at the next 5 to 10 years?
So we made a huge progress in the past 20 years. We can control diabetes very well. We have modern technology we are using. People who take insulin, for example, they have the risk of low blood sugar. So we now can provide them a technology called continuous glucose monitoring. You have a sensor you put on your skin. You don't have to monitor your blood sugar 4 or 5 times a day if you are on insulin. You can just simply get the result by a little reader that reads the sensor reading. So we have a lot of advances. So not only we have advances in diabetes diagnosis, in early diagnosis, we also can monitor diabetes much better due to current technology. And we also can prevent complications because we now have not only medications to control blood sugar without making it too low, but we can also prevent complications by controlling cholesterol better and better drugs to lower cholesterol if the statins, for example, won't work. And we have much better drugs to control blood pressure without side effects. So we made a huge progress. We already know that in the past 15 years, the rates of heart attacks have gone down in people with diabetes. But we still have a lot of struggle ahead because people with diabetes tend to have not only a heart attack, let's say if they're out of control, but they are more predisposed to further heart attacks and heart failure if a number of these risk factors are not attended to.
Okay. Now, as you come towards the end of the interview, one last question for you is, let's talk about the age, for example. So how, if today we are, reading that people are diagnosed at a much younger age, that's number one. Second thing also is that suppose you are diagnosed with diabetes when you are 60 or 65 or 70-year-old. So how the treatment differs and what if you can just explain that?
Yeah, it is so true what you said. And this is really a very sobering statistic that we are getting diabetes at younger age. We're getting heart disease at younger age. And actually we may be wiping out some of the health gains that have occurred in the last 20 years by early diabetes in younger people. And it all goes back to lifestyle. People are sitting in front of the TV or their cell phone, not exercising, gaining weight. So as you know, 2/3 of America right now is overweight or obese. Same applies to Indian population, where we have more visceral fat in the abdominal area. Even though we may look like normal weight, we have more fat, which makes us more resistant. So I think diagnosing diabetes early in younger people and treating them early can actually give them much better lifespan with correct diagnostic and management approach.
Dr. Ganda, thank you very much for your time.
It's my pleasure.
And we are looking forward to listening to you at your talk at the Health Expo on March 10th.